What if the reason you have 20 different symptoms is actually one underlying driver? If you've ever felt like symptoms don't fit into one clean diagnosis, this conversation is for you. Maybe you've been told it's stress, or it's perimenopause, it's autoimmune, it's anxiety, it's fibromyalgia, it's chronic fatigue, and yet nothing fully explains the whole picture. Today we're going to talk about something that is frequently missed, not because anyone you've been seeing is incompetent, but because it doesn't have predictability. Tickborne illness is one of the most complex, multi-system patterns I see in exhausted, inflamed women who've been told their labs are normal. Please hear me on this. It doesn't mean you're foolish, and it does not mean that your doctor is foolish. Lyme and other tick-borne illnesses are easily missed because they don't stay in one system. When symptoms don't stay in one system, we stop chasing labels and we start reading patterns. I'm going to address something real quick right now that may not be something you're thinking about. I have never been around a tick that I'm aware of. I have had someone test me and say that it was Lyme. I did a Lyme protocol and it made a huge difference. Not all tick bites have that red bullseye circle around it that most people think of. Tick-borne illness doesn't necessarily mean that you knew you got bit by a tick. So just be aware of that. That's an important factor to consider. A lot of what I'm talking about is tick-borne. If you think, that's not my category, you might be surprised if we find something that is tick-borne. If your symptoms migrate, cycle, or change personality, that's a clue. Let's start with symptoms because that's what matters to you. Tick-borne illness can affect nearly every system of the body. Neurologically, it can look like brain fog, word-finding issues, memory lapses, light or sound sensitivity, internal vibrations, anxiety that feels physical, sudden depression, head pressure, and insomnia. Musculoskeletal system changes could mean migratory joint pain, neck stiffness, rib pain, foot pain, muscle twitching, and unexplained weaknesses. Energy and hormonal imbalances feel like cyclical fatigue, crashes after exertion, night sweats, air hunger, irregular cycles, thyroid dysfunction, and adrenal exhaustion. Immune and inflammatory signals can include random flu-like flares, swollen glands, temperature dysregulation, histamine reactions, food sensitivities. Do you see why it gets missed? It doesn't behave like a single organ disease. It moves, it migrates, it cycles, it mimics, and it morphs. Lyme and other tick-borne illnesses don't behave predictably. That's exactly why they're missed. Lyme isn't missed because doctors are foolish. It's missed because it's biologically complex. Some scientists classify tick-borne pathogens as bacterial, like Borrelia, protozoal or amoebic, like Babesia. Others behave in virus-like ways in how they suppress immune signaling. That complexity matters. And these organisms can change form, hide in biofilms, suppress immune signaling, and trigger inflammation without dramatic lab marker spikes. Standard antibody testing depends on immune response. So if the immune system is suppressed or exhausted, antibodies may not show strongly. Again, I want to emphasize it's not that anyone is missing something obvious. It's that these infections don't behave predictably. Because tick-borne illnesses don't behave predictably and standard labs are built to detect predictable patterns, you could easily and understandably see why they're missed. We don't start by assuming Lyme. We start by asking, what is driving the immune system? We do not guess. We read patterns. Firstly, symptom clustering. Is it migratory? Is it multi-system? Is it cyclical? Is it neurological and inflammatory together? Secondly, inflammatory markers. On the root cause landscape blood panel that I use with all new clients, GlycA is the marker that reflects persistent immune activation. It does not diagnose Lyme. I don't diagnose anything. But when GlycA is elevated and symptoms match a chronic inflammatory pattern, that tells us the immune system is responding to something ongoing. GlycA doesn't diagnose Lyme. It tells us the immune system is reacting to something. Third, we do a gut and terrain assessment. Because here's the part most people skip. Parasites. Parasites love Lyme and other pathogens. They harbor bacteria, protect pathogens from immune detection, live off toxins, create immune confusion, and if parasites are present, diving straight into Lyme protocols may be a mistake because you're trying to evict one tenant while another is protecting it. That's why in my foundational protocol, phase 1 is always elimination support for everyone. Before we ever attack pathogens or toxins, we open drainage pathways, always. Before we fight, we clear. Before we attack, we open elimination pathways. The biggest mistake most people make with Lyme is trying to kill before they ever clear. Your body eliminates through the liver, kidneys, colon, lymphatic system, skin, and lungs. If any of those systems are congested and you aggressively kill pathogens, you create cytokine storms, neurological flares, panic-like symptoms, crushing fatigue, and long setbacks. Many people call it a herx or a detox reaction. Sometimes it is. Sometimes it's simply overload. We guide the body to clear before we ask it to fight. That's wisdom. It's not weakness. We guide the body to eliminate before we ask it to fight. It has to happen that way. Parasites love Lyme, and Lyme loves toxic terrain. In my foundational protocol, after elimination support is established, if indicated, we move into parasite detox because parasites, like I said, love inflammatory environments. They thrive in toxic terrain. They feed on metals and metabolic waste, and they shelter other pathogens. If we make the internal environment uncomfortable for parasites, we often reduce the pathogen burden directly. We want to make the internal terrain uncomfortable for parasites, uncomfortable for hidden pathogens like Lyme or other tick-borne illnesses, bacteria, fungus, mold, but as comfortable for the human in front of us as possible. That's the shift. We don't go straight to war. We change the environment so the enemy retreats first. I care less about aggressive killing and more about intelligent clearing. When we do address pathogens, I often use homeopathics as part of the process because they provide immune signaling. They help retrain response patterns, reduce intensity of detox reactions, and support the nervous system. Your nervous system capacity matters. Your mitochondria and cellular energy matter. Your mineral balance matters. Detox should not feel traumatic. It should feel supported. And your body needs to feel safe to move forward, not at war. So if your symptoms don't fit in a box, stop trying to force them into one. Your inflammation markers are elevated. We need to address it. If you feel like something is driving your immune system quietly, start with clarity. We don't assume Lyme. We don't assume parasites. We don't assume anything. We read the landscape. And that's why I love the root cause landscape so much. It tells us what big categories are in the way, and then we can test from there. We use smart lab markers like GlycA, which is part of my root cause landscape blood test, to identify persistent immune activation. And when those initial markers line up with your symptoms, we move into more advanced specific testing intentionally, not reactively. And we don't dive into huge volumes of tests right away if that's not what you want to do. That's how we stay wise. And your body was designed by God with an incredible capacity to restore itself. But healing doesn't happen in chaos. When we remove the blocks, whether it's infection, toxins, or hidden inflammatory drivers, and we nourish the system that supports elimination, the body does what it was designed to do. And that always begins with supporting elimination first. When we remove the interference, nourish the terrain, and honor God's design, the body knows how to respond. It's a beautiful thing. Remember, you are wonderfully made by God, just the way you are.